I'd like to welcome everybody. Thank you for being here. My name is Sam Swetchkenbaum, and this is a Medicaid info session for dental providers. I'm really excited to do this. It's funny. I think if about a few years ago, I spoke to a dental provider who had just recently retired, and part of his practice was seeing patients with Medicaid. And I had asked him, why did you participate in Medicaid? He said, number one, he felt as a professional, it was truly his obligation to help this community. And then he said it really helped his practice because he was viewed as a true humanitarian by the families of the patients he saw, and he knew patients wouldn't forever be in Medicaid. So he felt it was really an important way to have a successful practice. So I hope we can share that with you today. Why do we need you to participate? We'll spend some time looking at the data, but it truly does benefit the community. As more of our adult Medicaid members have access to dental providers, they can improve their overall health, they can improve their quality of life, and hopefully participate more in the workforce and society. We're having this webinar, and thank you to those who are both here and those who view this recording, because not a lot of dental providers realize the benefit of participating in Medicaid and the ease of being a Medicaid provider. We had raised our fees several years ago after hearing from the dental community, and we hope that that, combined with this information, will get you to participate. And then before we get started, I would just like to thank the dentists who currently participate. Many of them participate in very strong ways, those dentists both out in the community and at the community health centers, because they're truly making a difference. All right, next slide. So like I said, my name's Sam Swetchkenbaum. You're going to hear from me, and you're also going to hear from Andrea Rohrer, who is our provider liaison from Gainwell. I'll start in the beginning, just trying to make the case for participation. Like I said, Andrea will talk about enrollment and billing. I'll talk a little bit about dental policy, and then try to get some next steps for you so that you will participate. Then we'll have some time for Q&A. So again, like I said, just so you know about Medicaid, we have in Rhode Island more than 310,000 children, low-income adults, individuals with disabilities, and older adults who rely on Medicaid to connect to critical services like annual wellness visits, life-saving medications, home and community-based services, long-term care, early intervention, and oral health care. And here you can see a breakdown by county. So Providence County, the largest, has the largest number of participants. And Medicaid eligibility is determined on a number of factors: the person's income, the number of people in the household, or their disability status, and a number of other factors. So we have a whole team over at Medicaid who help patients in customer service to get them enrolled in Medicaid. Next slide. So when we started promoting, and again, many of you may have seen our postcards, our social media, a lot of our information we were getting out there to spread the message about participating. A lot of our responses were actually from Rhode Islanders who had Medicaid, who were having difficulty finding a dentist. So we know, and you can take a look at some of these comments, that if you participate in Medicaid, you truly can make a difference. You can really help those who are looking for dentists and feel that getting the good oral health they need will be a life changer for them. Next slide. When we look at the data, unfortunately, because we need more dentists to participate at this time, the access for adults in the Medicaid program is low. 72% of adults with Medicaid haven't been to the dentist in the past year. So only 28% of adults with Medicaid have used their service. So you can truly make a difference just by seeing a handful of patients. In addition, in the past to hearing about rates, We heard a number of other things from dental providers, which several of them are misconceptions. One is no-show rates being higher for patients with Medicaid. Our analysis that was done several years ago found really no difference in no-show rates. Um, the Medicaid reimbursement rates, as I shared, they were increased in 2023 by almost 100% for many codes. Now, the last time they had been raised was in 1992. And at that time, it was really the dental community that made the case for increasing the rates. And so that was very, very exciting to see that dentists recognizing the importance of having good rates. So hopefully, moving forward, uh, we can have rates that work for dental offices. Okay. Another misconception is that you need to provide care for everyone. No, you can limit the number of patients with Medicaid that you see based on your schedule or your practice's availability. It's very easy to apply online. Andrea will touch base a little bit about that. And then the other thing we know is that billing is meant to be simple. Integrating Medicaid into your practice should not be difficult. You do not need an additional hire. Gainwell provides resources to help every step of the way. Next slide. So now I'd like to turn it over to Andrea. Andrea, always grateful for your help, whether it's, I'll talk a little bit about our policy manual, but we work very closely to make sure that providers have the information you need. So thank you, Andrea.
Thank you so much, Dr. Sam. As Dr. Sam stated, my name is Andrea Rohr. I'm a provider representative for dental providers at Gainwell Technologies. Here at Gainwell, we partner with EOHHS as a fiscal agent to help with processing Medicaid claims, assist with provider enrollment, and to also help with any provider education and training along the way. So if after today's session you are interested in enrolling as a fee-for-service dental Medicaid provider, you will go to riproviderportal.org. You'll need to gather some information for the enrollment process, such as your National Provider Identification Number, also known as your NPI. You'll need your address information, including the last four of your postal code, your taxonomy code, your tax ID, either your employee identification number or your social security number, your license number. It doesn't state it here, but also the expiration date of your license as well. You'll need to also complete a W-9 with a live signature. We do not accept stamped or electronic. It has to be a live signature on your W-9. And it's not applicable for managed care organization providers only. So it is applicable for fee-for-service if you're going to enroll with us. Additionally, you'll have to fill out some federally required disclosures. That's just ownership information. And we do have a step-by-step a provider enrollment guide that can walk you through the entire enrollment process and what's required for filling out the application. We also do have a dedicated team of experts who can help you with your provider enrollment application. You can reach out to myself as your provider representative if you have questions filling out the application, or you can contact our provider enrollment department. I have their email address listed in this slide. It's rienrollment@gainwelltechnologies.com. And if you have additional questions, we have a customer service help desk that's available Monday through Friday, 8 a.m. to 5 p.m. Their phone number is 401-784-8100. So after you enroll, you have to think about how are you going to submit your claims to fee-for-service Medicaid. If you're not already established with a clearinghouse or a billing vendor, we do offer a free electronic claim submission software called PES, stands for Provider Electronic Solutions. So you can use this software to submit your claims to us. It's a free software, and the link here is actually it goes straight to the EOHHS website where you can download the software onto your desktop. If this is an option that you decide to choose, you can schedule some time with me and we can go through a one-on-one walkthrough of how to utilize the software. And during that training, we actually do submit a live claim just so that you get the breakdown from navigating the software from beginning to end with building your database. So to submit your claims, you can submit them electronically to us, or you can submit them on paper. If you choose to use paper claims to submit your claims to us, you can do either the ADA 2012 or the 2019 form. Those are the current versions that we accept for dental claim submissions on paper. And lastly, here is just my contact information. If you want to know more after today's training, you just want a little bit more information on, what that looks like as a Medicaid provider. And if you have additional questions, trying to navigate the UHHS website to get the material that you need in order for you to make that determination for your practice, here's my contact information. Feel free to reach out to me anytime. And on the last slide here, we just have some hyperlinks for some resources that are currently on the EOHHS website. We have provider training and education webpage. This is where you can see self-paced trainings and you can sign up for virtual trainings. You have the dental manual that goes through a breakdown of all the policy requirements, eligibility for members, billing, prior authorization requirements for certain dental procedure codes. It also gives a very nice description of not just within the policy, but also description of those codes and the terminology used and those covered and non-covered services within the manual. And the in-plan oral health benefits, these are the dental codes that the medical managed care plans will cover. So it gives a description of those codes as well. We have for billing and claims webpage, this is billing tips for dental providers and provider slide deck as well. This was a training that was that's a slide deck from a training that was done actually back in 2022 or 23 once the rates were increased. And then Medicaid claims payment schedule, that's the schedule that you will have to follow in order when you need to submit your claims by in order to know when you're going to get reimbursed as a provider. The link there for dental rates, that was the dental rates that Dr. Sam was alluding to earlier when the dental rates were increased. There's a separate page document itself that shows all the breakdown of those codes that were with the increase, what was the before and what they were changed to for the rate increase. And then lastly, the Medicaid dental practice management and quality improvement. These are just sessions for you to watch as well that are also posted on the UHHS website. With that, I'm going to pass it back to Dr. Stam to dive more in deeper to the policies for dental providers with Medicaid. Thank you.
Thank you so much, Andrea. So Andrea and I, we've worked together to have the dental services coverage manual, and I'm not actually going to go through it today, but I'd encourage folks to take a look. One of the things it goes through is what is medical necessity. So generally, procedures are covered if they're deemed medically necessary and will be, of benefit to the patient's health. We encourage you to review that. And if you have any questions, reach out to us, and certainly make sure your documentation is adequate to support that why a procedure is done. So we typically want to see what is the diagnosis, what is some of the information that led to your diagnosis. For example, if you're doing a root canal for a patient, what were the findings in terms of your examination? What were the findings in terms of the patient's complaint? And what is the diagnosis that led to? The manual also includes what codes are covered. And again, we're referring mostly today about adults. As most of you are aware, the children's program, or actually up to people who were born, people born after May 1st, 2000 are in the Right Smiles program, which is a managed care program. But we're referring to those that are born before May 1st, 2000, who are adults who are in the covered current fee-for-service program. And the adults, based on just the way the program was designed and the budget, not every service is covered. So for example, anterior root canals are covered, but posterior root canals are not covered. So we do encourage you to look through that and know by age. You'll also be able to see which services require prior authorization. So for example, scaling and root planing does require a prior authorization. Then, as Andrea mentioned, there are some services, many of them are more of the surgical services, which are considered in-plan oral health benefits. So biopsies or certain treatment to address trauma. We just encourage you, this applies mostly to the oral surgeons, that if you are doing those procedures, those are covered through the patient's medical managed care program. So if you need to do those, I'd encourage you to contact the patient's medical managed care program to find out about participation or to file a claim as an out-of-network provider. Okay, so and I just want to share what we're anticipating in the future. The Rhode Island legislature did approve moving all members into managed care. So as I said, currently the current Right Smiles program includes children and young adults born after May 1st, 2000. And we will soon be at a phase of what we call request for information, where we will reach out to Rhode Island organizations and other organizations to get information about what they think will be the most effective way to have the Right Smiles program for both children and adults in the future as part of a future procurement. Managed care has many advantages, including being up to date with quality measures, care coordination, and more. So I think that's exciting. We look forward to that sometime in 2026. But be aware that if you we hope that people will still sign up now, because we have still a lot of time before 2026 and a lot of Rhode Island adults who need your participation as Medicaid providers. So again, next step, please go to our website. We hope you can find some helpful information. And Andrea, like I said, was gracious to offer scheduling a meeting with us should you need additional assistance, and that you can enroll and learn more by visiting riproviderportal.org. So thank you.